Greetings, everyone. My name is Poran. I am a psychotherapist, a clinical supervisor, clinical counselor, and social worker in my background. And I'm doing these videos to raise awareness about a series of talk about applied psychology, how we can bring in psychology into our home by understanding various domains of what's going on for us. Today, I'm going to be talking about children's mental health, and the signs and symptoms. So, if you are new to this channel, please like, share, and subscribe to my channel. And hoping that I can reach out to more people like yourself, and this video might benefit you or someone else. So, this is a very conceptualized way of looking into children's mental health, and I'm going to be talking about some signs and symptoms that could be recognizable for you. It's important because at times our children they change. Of course, we are human beings, we are changing every day. Our children can change their behaviors, everyday life, and we might only think that or blame it to their regular development or being a teenager. Teenager is challenging, and the normal way of excusing to look into how our children could have some sort of mental health issues. And over the years, I have been a psychotherapist. I have seen a large number of families not recognizing those signs and symptoms, and therefore the mental health challenges such as anxiety, depression, has been ongoing and kind of has become chronic for their children and teenagers. So bear with me. I mean, bring a paper and pen and write it down if this is something important to you, and share it with others as well. So it could be hard to tell the difference between normal changes as our children grow, and also the symptoms of mental illness. That's why I'm doing it. And some sudden changes in their behaviors are very important to look at. There are, for example, an active child becomes suddenly quiet, withdrawn, or a good student. I mean, our children can be good in their school. However, suddenly or gradually, we see that, oh, they are declining, and or they showing poor grades and poor behaviors. And sometimes we see that, okay, our children have been a vibrant child, talking about their emotions. Suddenly they become quiet and showing unhappiness, or showing signs of worries, guilty feeling, anger, or being fearful of going to some social events, or being with other children or their peers. And sometimes we see that, oh, they show some sign of hopelessness, and or they feel rejected. So what's going on? We need to find out. And at times we see that children and teenagers, they start avoiding places, situations, people, and we don't understand why these changes are happening. Therefore, it's very important to kind of look into those and observe it and write it down, so you can talk to your mental health professionals and to your GPs to talk about this and find out. You do not let these signs and symptoms go away. I mean, because they cannot, people cannot just change because we do not recognize the signs and symptoms. I mean, the children, you cannot just see that, think that, okay, this is going to be okay, he or she is going to be okay, and this is part of the normal development. If there are sudden changes of behavior and things, something must be wrong. We have to find out what's wrong without the blaming of the child, without trying to kind of put pressure on the child, saying, okay, what's wrong with you? Tell me about it. All those way of kind of interrogating our children doesn't help. And if they are have decided, or they are afraid of talking, and they have decided not talking, they are not going to talk. So therefore, it's important that there are um, issues or challenges going on, maybe in their daily life in a school or in their environment, and maybe they are being bullied. Maybe someone is kind of putting pressure on them, online challenges that are many today, right? And mm, also looking into if they are showing more sign and symptoms of physical pain, physical discomfort, and such as complaining about headaches, stomach aches, and a problem in eating habits and sleeping and general lack of energy. These are kind of some signs that we need to pay attention to. Or at times we see that they are suddenly, they started to kind of not share anything with us, not any physical pain or suffering or any psychological pain or suffering. They are not going to share it with us. And at times, teenagers, they go out, they try to kind of experience various things such as alcohol and substances, and especially when they are alone. If they are too alone, and also they are finding some lonely person or people like themselves, someone who has not many kind of social relationship, or in wrong groups, they start to kind of use alcohol and drugs and substances to calm down, to feel energized, to kind of get better. However, we know that there are tons of issues out there. I mean, all the overdose crisis that our people are going through. I mean, in North America, it's huge, and everywhere else, I think this is a global issue. And at times we see that there have some signs, there are showing some trouble coping with regular activities of an everyday life problem. For example, the school says, oh, we are going to go for this activity, and the child has a hard time to cope with it, to manage a situation, to talk to a coworker, to a peer or to their teachers. And at times we see that they are showing little regard for people's pain and suffering, and feeling of others, lack of empathy for others. We see that they are showing some signs of cruelty and towards others. And these are behaviors that we need to understand. And some people, some children start kind of expressing disgust over their weight, or disgust over their eating habits, or unhealthy relationships they start with, and they start maybe making odd or repetitive movements beyond the regular playing, and also they start deliberately hurting themselves or talking of suicide. And self harm is huge for teenagers who have emotional pain and suffering going on for them. They are not managing to talk about. And unfortunately, there is this notion of, oh, if I cut myself and harm myself, maybe I feel something, which is not true, and they are afraid of feeling their pain and suffering. Therefore, they are avoiding it. And this is the same thing for adults too. This is part of our human nature as well. We are afraid of feeling, afraid of our emotions many times. And because we don't want to feel our feelings and emotions, if we have negative experiences in life, and personal, interpersonal relationships are challenged, then we are kind of trying to avoid looking into what's going on, and we are looking for some tools or substances or ways or patterns of numbing ourselves, right? That's why people go to substances or alcohol and drugs. That's how they numb themselves to not feel. Whereas the feeling and emotions, the problems, the challenges, they do not go away. They are there. Therefore, in order to deal with the emotions, we need to learn how to feel the emotions. Without feeling our emotions, without becoming realistic about what emotions do for us, we cannot survive in a healthy way. Therefore, children and teenagers they can get into or develop some mental health challenges, especially depression and anxiety. I mean, panic attacks. I have seen tons of teenagers over the years complaining about panic attack. And when we go through to what kind of sign and symptoms they have seen, I mean, this general way of getting panic attack, suddenly something starts and they get afraid of their body and physical reactions. Therefore, the kind of the process of feeling the panic attacks and panicking on panic attacks, it becomes worse and the sign and symptoms increases. So the person feel like, oh, I'm dying, something bad is going to happen. And therefore, we need to recognize and be able to communicate healthier with our children and teenagers. At times, I have seen many families they kind of blaming the child for these signs and symptoms, blaming the child for being physically ill or complaint about physical illness or complaint about physical pain, or they are blaming the child for uh, feeling bored or not knowing what to do or not willing to talk to their peers or not willing to find friends or not having friends. I mean, if your child doesn't have any friends, how can you push your child to have friends if that child doesn't have the skills or abilities or knowledge or interpersonal relationship skills to how to connect with others? Therefore, you see, we pushing the child into finding friends, or we try to find friends for them. These are all kind of giving the children wrong messages that they have something problematic with themselves. They are something, they are the problem. Whereas children are never the problem. Problem is how their environment is leading them towards the problem, right? Children, and we are not the problem either. I mean, if we have mental health challenges, depression, anxiety, phobia, panic attacks, or mental health illnesses, I mean, is it our problem really? No, we have been led into situation and conditions. I mean, look into our world today. I mean, our biology, our physical body is affected because of our environment. The food we are eating at times not very healthy, and the amount of sugar we are using, the lack of exercises, the amount of fat we are kind of having in our food. I mean, all those concepts, of course, are affecting our physical body, and our physical body is connected to our mental health, to our brain. I mean, if our brain doesn't have proper healthy food, therefore, it's going to show it somewhere in the way of feeling, in the way of thinking, and behaving, our habits, our patterns. Therefore, the knowledge of those signs and symptoms, not only for our children and teenagers, for ourselves as well. If you're suddenly started feeling different and suddenly started having no interest, no energy to attend the social gatherings or spending time with others, there must be something, right? And that's why I encourage you to learn those symptoms. And if there is anything, if you realize there is challenges going on, talk to your mental health professionals, talk to your doctors, and hopefully you can be referred to proper health and support. So I think we are worth learning more about our children, and our children, they are worth paying attention to. So we all deserve a healthier lifestyle and coping strategies. Take care of yourself, guys. Bye bye.